Okay, welcome to this episode of the Paul Burgess Show. I am Paul Burgess, and I'm here today with Dr. Nicole Srednicki. I think I've pronounced that correctly, and if I haven't, I apologise massively. It's a tough one, that surname. She's an anti-aging and regenerative medicine specialist from Scottsdale, Arizona, no less, where it's now kind of 10 a.m. over there, and I'm sure they've got sunshine, and we're sitting in the pitch black in the UK, but never mind. Nicole, welcome to the show.
Thank you. Thanks so much for having me.
No, my pleasure. And we were trying to get this done a little bit earlier in the month, but we had a few issues that maybe we'll talk about later on. Depends on how confident you become. We're going to talk today about some slightly more unusual and cutting edge kind of treatments that are available to people, but they tend not to know about. Certainly when it comes to some of the things like stem cells and that kind of stuff. But before we do, tell us a little bit about you and your background and how you came to be where you are today.
Sure. So I specialize in peak performance through precision diagnostics and cutting edge anti-aging treatment. So what my goal is to slow the aging process for people. And so my background, I was conventionally trained. I went to Georgetown University as more of like primary care. And I wasn't really thrilled with what medicine had to offer my patients because I felt like it was very insurance driven and just get patients in and out and, how not to get sued. And I really felt like it wasn't doing much for the patients to actually help them heal. It was like, once they're sick, here's a prescription, goodbye. So once I finished school, I said, what else is out there? This can't be it for medicine. And I came upon something called anti-aging medicine. And this was where you actually are looking kind of down the road. What can we do to help prevent accelerated aging, and what can we do to empower patients? So I got board certified in anti-aging and regenerative medicine, and then I also completed a fellowship in natural medicine because there's so many things that are amazing types of natural medicine that can help heal the patient, including, spiritual and emotional type healing modalities, which we never learn in conventional medicine. So I look at medicine from both kind of the Eastern and Western perspectives to treat mind, body, soul, physically. So then I've also specialized in stem cell therapy. So I'm on the ethics committee at the American Academy of Stem Cell Physicians, which has been really exciting because this is true regenerative, cutting edge technology that has changed so many lives when there have been patients that have, they've been told by their doctors, well, there's nothing else we can do except for symptom management. And from what I have read and seen and even utilized is changes for these people. And so I'm kind of on a tangent here through my whole story, but I feel so strongly about empowering patients and letting them know there are so many options for them in the world. You're over in the UK, I'm here in the US, and I love being able to speak with you and show people what else is available.
Absolutely. It's so important that people understand conventional medicine is not the end of the road. And generally, we find that when conventional medicine has tried all its options and the patient isn't improving, we're able to then start looking at things from a very different perspective. So we want to know your timeline, what happened at birth. Were you natural? Were you cesarean? Ideally, what were your parents' health like before conception, all that kind of thing. And because that whole thing builds up a picture for us and then allows us to start potentially treating patients in maybe an unusual way that they weren't expecting, but it can get some very good results. So being a doctor in traditional medicine and having the knowledge of the functional side is almost as good as it gets, I think, when we're looking at patients, right?
Yes, absolutely.
Right. So you got into stem cells and exomes because it's kind of one of these areas that people kind of have heard about, but it's quite hard to get hold of. It's really difficult to know that you're getting good quality product because it's like anything. There's a lot of stuff out there that isn't great. And then there's some restrictions on how it can be used and whatnot. So tell us the principle behind stem cells. How do we know if we're going to be getting something that's a good quality? And what is it going to do for people in the right circumstances?
So stem cell and exosome therapy stem cells have been around we've been studying them for over 20 years. So when I'm always looking at, what's cutting edge. And I say that with cutting edge yet has science behind it. So we've been studying these cells for years now. And as you said, yes, finding quality is of the utmost importance because there's still so much we are learning about them. And the principle behind stem cells is to basically, I call them youth cells because that's what keeps us young. So when we're born, we have like endless amounts of stem cells and they keep replicating. So approximately every 10,000 cells is a stem cell when you're a child. But as we start to age, this slows, and that's what starts to cause the aging process. But what stem cells do is they repair, they replace, and restructure our own cells. So they're very stimulatory. They're constantly regenerating our cells, our tissues, our whole body. So stem cells are really important. And a newer technology is called exosomes. And exosomes are what they call the secretory vehicle, or like the little taxi that gets the stem cells to where they need to go. They're very intelligent and they communicate between the cells. And more recently, they've realized that even exosomes alone have a big effect on healing and regeneration because they are very anti-inflammatory. So when I started looking into this field of medicine, I was skeptical, just like everybody else, because my motto is I'm not going to do anything for my patients that I wouldn't do for myself or for my family. So, I started hearing about stem cells several years ago, and I'm like, what's this? And so I started researching, and I started to find out that all the things that they were using to as therapy for patients. So they were treating chronic diseases like diabetes, asthma. It's kind of endless what they're treating. Chronic fatigue syndrome and cardiovascular issues. And then we treat autoimmune issues. So MS, arthritis, or it's used therapeutically with these. And then we use it as anti-aging. So we're actually using them in face procedures. They're using them for sexual enhancement, sports performance, hair rejuvenation. Going back to autoimmune issues, thyroid issues, psoriasis, Crohn's, and with chronic issues, even they're doing a lot of work in Japan and some of the other countries, but even here in the United States, treating Alzheimer's, something that we all fear. Underlying causes, so chronic inflammation, this is huge with regenerative, some of the uses for this. Now, knowing how to find the right product is extremely important. Depending what country you're in, they're using different sources of stem cells. And so these are the things that we really have to educate ourselves on and know, where these products are coming from, knowing how they're handled, knowing cell counts, things like that. So kind of backing up a little bit, here in the United States, we are able to what's available on the market. Okay. FDA has their say in things, and then what's actually available here in the country. So we have autologous which this is coming from ourself. So this is coming from fat or bone marrow, and this is where the practitioner would extract some fat or bone marrow, and they manipulate it and expand those cells and re-inject it into an area where it's needed. Then we have allogenic. This is coming from an external source. And so this usually comes from cord blood. It can come from amniotic fluid or Wharton's jelly. So it is coming, it's perinatal, okay? In the United States, embryonic is illegal. So we don't really see that around here. That is available in a few other countries. And then we also have xenograft, which is stem cells coming from animals. That also is, I've heard of people getting it in this country, but really it's not readily available. So for me, what I have seen the strongest evidence and results for was using allogenic stem cells. So again, this is perinatal. So once the baby is born, either a certain part of, the umbilical cord or something is utilized, and this is where the stem cells come from. I really like this method because the stem cells are so young that they are constantly replicating. So the rate of replication, as I was saying before, is huge, versus if we were to take these stem cells from ourselves, that rate of replication, the total number is going to be much lower. And it's also been, these cells have been exposed to our own environment for however long we've been around, if we're 50 years old. And so, we are constantly being exposed to toxins and things like that. If you smoked or you have diabetes, like, our stem cells are not going to be as healthy as when you're born. And also when, obviously there's a little bit of downtime when they're doing this procedure to, pull these cells out of your fat or your bone marrow. And then when they're re-injected, they know, because of exosomes, they know where to go within your body. And if you've just had damage to that area, a lot of times they can go potentially back to that area. So if you just had fat extracted, it might go to that area versus another area where you were thinking.
And I think that bone marrow extraction is going to be quite painful as well, I thought.
Absolutely, yes. I have heard it's not the most fun extraction. Then, when you're talking to practitioners, it's really important to understand, ensuring that these cells or secretions have gone through proper testing. So we want to check, obviously, for disease. And so that's huge. Understanding, have they been tested, and for everything that needs to be tested for. I think you need to be very specific when you're questioning a practitioner. Then knowing how they've been handled. So, what type of lab have they been using? How have these cells been stored? With stem cells, they are very, very volatile, and you can damage them very, very easily. So they have to be stored at, in either cryo freezer, or like what I have in my office is a -80-degree freezer, which is optimal for them. And you need to understand the handling, getting from the lab to you, and then your process of thawing them and then using them to actually inject into the patient. And then viability, that's huge as well. So making sure they're alive. So we have so many products on the market now that either they might come from a freezer, but were those properly handled in the lab? Were they properly handled during the delivery to you? And then did you properly handle them? And then, we're seeing now products that are shelf stable. Honestly, that's so new. That's kind of what I'm looking into now. Like, how are those cells still alive if they are